I'm Keith Flaherty. I'm a medical oncologist at the Massachusetts General Hospital Cancer Center. When I was entering the oncology field in the year 2000, I looked at melanoma as a disease and thought, well, available therapies, chemotherapies and the like do so little for this disease. There must be something in the molecular understanding of this disease that can actually give us a new handle. And this approach really has been echoed in numerous other cancer areas. And so it was in the year 2002 that there was a seminal scientific discovery that pertained not just to melanoma, but principally to melanoma, where a mutation was discovered in a gene that then when the gene and its enzyme that it encodes are altered or mutated, it plays a very significant role in the formation of melanoma, and as it turns out also the dissemination and ultimately potential fatality of that disease. So it gave us, all in one day if you will, a target for the first time, a thing to actually think about trying to create drugs for, as opposed to bombarding in a very general way.
Keith Flaherty and colleagues, when they saw this, when they saw that melanoma cells had this mutation, it occurred to them, can we use a drug that inhibits and that targets only the cells that have this mutation? And this is a very elegant idea.
There are many patients who rather quickly in this diagnosis are searching for something new, something different, something that might give them some better hope or better chance.
There were people saying there's no point. Drugs have failed in melanoma. We should only be approaching this with immunotherapy. Drugs simply don't work. I've sat in rooms, Keith sat in rooms, where the very concept of any drug, to some people who are important, smart, and experienced, their perspective has been that drug approaches for melanoma will never work, period. The cell is intrinsically resistant and it cannot be done. So there is a proof of concept that has blossomed from this work that has demonstrated that even melanoma can respond.
We really think that at this point what we're on to are the types of therapies that can turn cancer into a chronic disease, even when it's in an advanced state. Curing wherever possible, of course, but being able to basically stall it, slow it down, and really dramatically change the nature of this disease and what it's like to live with this disease.
What Keith is trying to do is to be able to improve outcomes for individuals, one patient at a time. Keith is someone who was just never satisfied with the status quo, scientifically or for his patients.
Appreciate
of course.
that. Thank you so
Yeah,
much.
of course.
Treatment against this mutation has been the biggest breakthrough in melanoma in decades. So patients who come in with melanoma that's spread throughout their body, if they have that mutation, they can take a pill twice a day. And 80% of patients will have some shrinkage of their tumor, and sometimes they completely go away.
In the history of melanoma, this is without doubt, I would say over the last 100 years, the most important breakthrough that has happened, because it's the first time that one has a reasonably high degree of predictive accuracy in saying that a patient who has a certain mutation has a high likelihood of responding to the treatment. Unfortunately, the magnitude of the clinical responses that Keith saw in these patients is limited. It's only rare patients where the tumor entirely disappears, and it is only rare patients in which the durability of that shrinkage is long.
I'd say at 2 in the morning, it's usually not the science that keeps me awake, but the patients. And what gets you out of bed in the morning, frankly, just the same, is giving everything you've got into a problem that the individual who's affected, their family, their friends, everyone they know, cares about nothing more than that engagement. This struggle is so primary for our patients, and it's extraordinarily satisfying to roll up one's sleeves and sit down with patients and wrestle with those problems every day.
Cancer is tough. We are making progress, but we need talented and passionate physicians that are willing to take risks, that are willing to understand which are the questions, and are willing to bring them to the clinic. And I think Keith exemplifies this so well. This is the new breed of cancer investigators. These are the people that will bring us to the next level.